staffing shortages led to at least one emergency room in Ontario turning to nursing students and medical residents to keep up with increased demands.
In some rural areas, the shortage has forced ERs to shut down for hours or even days. So far, Hamilton, Halton, and Niagara have been able to avoid such extreme measures. But as Matt Ingram reports, hospitals in our region are feeling the pressure.
A high demand for care in the emergency room at St. Joe's Hospital in downtown Hamilton has become the norm this summer.
And so each day is really busy.
Chief of Emergency Medicine Dr. Greg Rutledge says the number of patients seeking treatment has gone up in recent months, partly because people with chronic conditions who did not seek treatment during the height of the pandemic are now coming in.
The patients coming through are complicated. It's harder to discharge them, so we feel that in Emerge, the higher volumes. We're just seeing more people coming back to hospital.
And partly due to major staffing shortages across the healthcare industry. There are nearly 700 job vacancies across the St. Joe's and Hamilton Health Sciences hospital systems.
We have less nurses available to care for the patients.
Plus, hundreds of staff are isolating due to COVID, just as the city of Hamilton reports an increasing number of COVID-related hospitalizations. The shortage and the increase in patients is combining to cause impacts on service and increasingly high wait times across the hospital sector. Just 2 weeks ago, Rutledge says the time it took to get a bed for a patient brought in on an ambulance had jumped way up.
We were seeing double, triple those numbers that we would normally see.
West Lincoln Memorial here in Grimsby has one of the longest wait times in our area for an emergency room patient who then needs to be admitted to hospital. The province reports that on average it's about 51.7 hours. Now that's more than double the provincial average for all hospitals across the province, which is 20.5 hours.
Greater demand with less capacity leads to a very long lengths of stay.
Chief of Emergency Medicine for Hamilton Health Sciences, Dr. KULDEEP SIDHU, says West Lincoln has fewer beds, partly due to a COVID outbreak. And that's why the wait time for ER admission patients is so high.
This is probably as busiest as I've seen it in my career.
He says his ERs are seeing higher numbers of people infected with viruses, including COVID, as people increasingly stop taking pandemic precautions, as well as sicker patients who didn't seek treatment during the pandemic, just like at St. Joe's.
Advanced level of cancers that we're seeing in the department, advanced level of heart disease and heart attacks that people didn't present earlier.
Both St. Joe's and HHS say despite the challenges, they have enough staff to accommodate an expected increase in patients this long weekend. The Hamilton Paramedic Service says it too is dealing with staffing shortages, but it says it expects to have near normal or normal levels of staffing for this long weekend. I reached out to Niagara Health. I wanted to speak with them too. They didn't have anyone available, but they sent me a statement saying they too are feeling the pain of these staffing shortages and that their emergency rooms are being especially hard hit, and to expect that waits and delays are going to be the norm for the future. Now, this problem, of course, is not unique to our region. Earlier today, I spoke with an ER trauma nurse from Toronto, and she says she's seeing the same thing and it's impacting the level of care.
There's just a high flow and influx of patients. Waiting rooms are full. We've got a high capacity of ambulances coming in as well. So it's been rather challenging to manage at times, to manage our patients and to make sure, you know, that all patients and their families get seen. There's been issues with bed spacing. So placing individuals into rooms, into beds. You know, we've had issues where it's so full and it's so crowded, and then we have a whole bunch of patients waiting in the waiting room or waiting on an ambulance stretcher just for a spot to be seen.
Hamilton Health Sciences, St. Joe's, Niagara Health, and the Hamilton Paramedic Service all asking people to think twice about going to the emergency room. Only go if it's an emergency. If you can, go to an urgent care center or seek treatment through a family doctor or through Telehealth Ontario, please do so.